guys, we are here at Toledo Lasik and it is our D-Day. We are done with glasses, done with contacts, done with squinting, and done with headaches, hopefully. Anyway, but today is our surgery day, so we're going to go in here, we're going to show you guys every step of the way from pre-op to post-op to the entire procedure. We're going to be in the operating room, so for those of you guys that may have a fear of LASIK, we're going to show you the whole process. Hopefully it alleviates a little bit of your concern. But this is a great option here at Toledo Lasik here and in Sandusky. You can click on the link below and get a discount through our link as well. So let's go find out what we're going to do and get checked in.
Words.
Yes.
We're doing surgery on both eyes.
Correct, not my legs.
And yes, sir.
I want all my limbs.
And you are Caitlin Ackley. And we are doing surgery on both eyes. And yes, it is upside down.
Yep.
So the doctor can read it when you lay down.
I've never had Valium before, so I have no idea how it's going to affect me or what it does. I think there's a lot of people that may have some fear of LASIK, you know, because anything with the eye, any kind of, you know, surgery can be scary, and, you know, she definitely falls into that category, and we want to show that hopefully somebody comes full circle. That she goes from full panic attack this morning to, hey, that wasn't that bad, and now I can see. So
Oh, here she is.
Hi.
This is Dr. G.
Dr.
Nice
G,
to
nice
meet
to
you.
see you.
I'm Brady.
All right, Caitlin, you guys excited?
I'm excited. Terrified.
Oh, that's normal. We'll give you a little medication to relax, but it goes pretty quickly. You're gonna do awesome. All
Great.
right.
Excited?
Cool. Yeah, we're excited for you. Gotta get those glasses
Yeah,
out.
yeah.
You guys wear contacts or just glasses?
No, just glasses.
Okay.
Yep.
All right. Well, excited for you. We're gonna give you some medication, get you prepped, and then I'll see you soon. Okay.
Okay, awesome. Can't
All
wait.
right.
Alrighty, come on back. You can both come on back.
Okay, so we're in the prepping staging area. So she's gonna talk real quick. Hold on.
Oh, you can be lazy boy too.
Well, I just want to be right here just
Okay.
in case she, you know.
Yeah.
The closer that we get to this room, I feel like the more anxious you're gonna. I can look at your little feet close up.
Okay, don't take a
Those
picture of me putting
are
the
the
gloves
nerves.
on backwards because I can never get them the right way.
I see that. So this is the worst part of it. So you do have to have an enema before you go in there. So they're gonna putting on the gloves. They've gotta go in there and give us that colonoscopy before we go.
Bend over and cough.
Strapping on.
Everybody hates this part of it, and especially them.
We are going to be covering your ears with gauze. Doctor uses a lot of saline just to keep your eyes moist, and sometimes it runs down into your ears and it'll just tickle. So it's no other big deal than just to keep your ears dry. So like a puppy, you don't want to shake them if your ears get wet. Now lay your head back for me, and Ray's going to do the same for you.
Would you actually put his help his? Alright, Mr. Brady, we're going to wipe off your eyes with some magic fluid here.
Okay.
This is actually salicylated. I'm going to have you keep your eyes closed while I do this because they'll sting like crazy if you open them, okay? Alright, this is going to be cold and wet here.
And I'm going to do the same with yours. Close your eyes for me.
Get a nice raccoon
No,
eye.
you're good. It's just wiping your eyes off. I'm just getting them real good and clean.
I'm gonna
We have a lot of
use dry-
bacteria in our eyelashes that we
Dry
can't
gauze
see.
here. This dry gauze just to feel a little scratchy in your eye for you. Same thing on this side here.
Now I'm going to wipe it off.
Moist gauze.
After I wipe it off,
Same
wait
on the
about a
side.
minute or two before you open it because
And
the
then one more
fumes
dry.
will burn
Once
also.
that finished drying, you're going to keep your eyes
Just
closed for a minute or two just to let that finish
let
air
that dry.
Put this back on. So, yeah, perfect.
Now what we're going to do next is let you
Super
guys just
sexy right now.
relax and let the Valium start taking effect. Because it takes anywhere from 15 to 30 minutes for the Valium to really kick in. We've already had it, so, okay?
Is this the time where if she or I would need another half, she should probably...
In about 15 minutes.
Okay.
Yeah, and if the doctor comes out and you're not ready yet, just let her know and we'll take the person that's next and then give you the other half and let that kick in.
Okay.
Okay? You're going to do absolutely great. Come get me if you guys need me, okay?
Thank you.
Do you want your feet up, Caitlin?
No, okay.
Are you sure? Okay.
Thank you.
Uh-huh.
There she is. Justin left us too. He drove home.
Peace out.
Being real quiet.
So we are in the prep area here at Toledo Lasik, and as you guys saw, they prepped our eyes. They cleaned us with like the iodine swab, cleaned that up. The weird gauze in our ears is because they use saline to wash our eyes out. So this is the, you know, so it doesn't just keep washing into our ears. The surgery room is right over here, and so for me, I'll start with me. So I haven't been really, I would say, nervous about the procedure. My focus has been more on her, and I think it's because I know how nervous she is. So any nerves that I have been, you know, secondary to how she feels. So because I want her to feel.
Feet are still going.
Yeah, I want her to feel safe and feel okay. That's why I'm going to go first, so she can see that it's okay, and I came out just fine. And we're going to show you that entire process right over here. That's the surgery room right over there. He's actually going to go in there with me, and he's going to watch and show you guys the entire procedure, so you know exactly what's coming. So there's no like, oh no, what about this? You're going to see the whole thing start to finish. And we have about 10 minutes or so, 15 minutes before said Valium kicks in. And so I would love for you to say the same thing, like what you're feeling, what your nerves are, what you're anxious about.
Still terrified.
Just that's her only thought right now is I'm
The feet have slowed down.
terrified. You're gonna be just fine. Plus you're gonna be able to see.
I don't like anything that has to do with my eyes.
I know.
I can't even like touch my eyes. I can't put contacts in. I can't do anything with my eyes. I want to talk about it. I'll cry.
Okay, that's fair.
Yeah. Honest. That's what we want. We want. Yeah.
That's how she feels.
That's how you feel. I know.
You are going to do so well. How are you starting to feel? Are you feeling any reaction to the Valium? I don't think we'll be able to tell with you.
What's that mean?
I don't know.
I'll take another half.
You can get another half.
Whether he needs it or not.
Whether you
That's
need it or not.
discrimination. Okay, so my legs feel tingled.
What is LASIK?
Okay, so I know very little about how it works. All I know is that they're going to go in and they make a small incision, and they take the flaps and they essentially turn them over to correct the size of your cornea. So your cornea gets like elongated, and that's why when you can squint, you're compressing that down, and you can change your vision slightly to get back to what your cornea shape should be. So they're slightly reshaping your cornea back to what it's supposed to be, and they shave off just a tiny bit of that layer of your cornea to get it back to that 20/20 vision. Now, here's something about LASIK that a bunch of people don't know that I've learned as well, is that it's going to affect your nearsighted vision, because nearsighted means you're seeing far away, right? So it's going
It'll correct your distance.
It'll correct your distance. But, if you're 40 to 45, you may still need reading glasses over time. And they definitely, and I've noticed that every visit they have mentioned that many times, that, now keep in mind, you're going to see things far away great, but over time, as you get older and your eyesight degrades, you may need reading glasses for things that are up close. So keep that in mind. I'm feeling
loopy?
I'm feeling that it's hitting me about 70% now. The numbness in my legs is now moved up to the
Bottom of the man boobs?
to here.
Top of the man boobs.
So fingers are feeling pretty
show.
good. I can honestly, if I'm fully honest, I feel like I don't want to lift my arms. Like when I do this, I go, and I don't want to do it. I really did want that other half, just to see how crazy. I want it really unhinged.
This is getting there.
And I look absurd with this on, so I probably look like I have to.
Bro, I gotta take a picture for Discord.
Okay.
Don't put the hood up.
Hood up or hood down?
Oh my god.
Alright, guys.
That was so fast.
I know. So, who's up first? Great. All right, so
Just-
we are going to do, whoa, got it, yeah, let me give you a hand here.
I got my seat legs underneath me.
All right, my friend, we're going to do LASIK for you today. I'll walk you through it, okay?
Yep.
All right, right over here,
Okay.
there's a little step up.
On this one?
Yep, step up. And go ahead, JC, right there. So I'm going to start by putting some honey drops in your eyes so they're nice and comfortable. You might feel a little sting when it first goes in, okay?
Sure.
So there's 2 steps to the LASIK procedure. The first step here, this machine is going to be your class. It's super quick, okay? 15 to 20 seconds, you're not going to feel anything. All you got to do is look at a green line, and I'll bring it right to you, okay? Then we'll swing you over here, and this does not remove your prescription. You're just going to hear some noises. You're not going to feel anything here, okay? Just a little tap there. All right, go ahead and look up for me. This is how you draw. Just close your eyes there for a second. We'll let that kick in. All right. This is, looks like you actually have more astigmatism in your left eye. This is just going to help get it nice and lined up for that. Perfect. Just turn that off. Okay, good. All right. Straighten your head down. Just, yeah. Relax. Perfect. Wait. Focus real big. Here. Wait. All right, so we're going to have you lay down now. So your head goes right to this little cup. That goes right underneath your knees, exactly.
Oops.
No, just a little bit towards me. Yeah. A little bit more, a little bit more. A little bit more. That's perfect. All right. As comfortable as you can be?
Yeah.
All right. So we're going to start with your right eye, okay? Just a little cover over your left eye. And one more bumper drop in. Okay. Alright, so I'm going to help you out now by keeping your eyes open, alright? Go ahead and open both eyes nice and big for me. You're going to feel a little tickle here on your eyelids. Now squeeze too hard. And you're just going to feel your eye open. Perfect. Try to keep those eyes open there.
Just let me know if I'm in your way. Okay.
Alright, doing okay? Awesome. Alright, now we're just going to turn your head and get you lined up just like that. That looks great. Good job, the machine. Now I'm going to kind of hold your head here just for a moment. Try not to move. Alright? I am going to kind of slightly adjust things to get you perfectly lined up as we get this other machine now. Now direct your attention towards that white circle light. See that? Chin down just a touch. Perfect. Both eyes open. Just look towards that white light. And as you get closer, what you're going to see is a blinking green light. And you're going to look right at that light. And go right back. Alright, getting closer here. Are you able to see the green light just yet?
Yes.
Alright, nice and steady, just straight ahead on the light there. Perfect. Alright, just get you lined up. Doing great. Look just a tiny bit to your left, please. Yeah, a little bit more. That's great. Alright. Perfect. We're gonna get your flap down and just keep looking right where you are and don't move.
It's pretty cool.
Straight ahead. Nice and still. Excellent. Doing great here. Back to. Things may go a little fuzzy here. Don't worry, that's normal. Just have a few more seconds and we'll be all done with the class. Doing perfect. Awesome. Alright, we're gonna take out this little instrument. Go ahead and open real big for me. Excellent. Close your eyes. Relax. Alright, so now you know the drill. We're gonna just use it here on the left side. Go ahead and open it. Now we're going to turn second to have that. Just right there, okay? Section all right, we're gonna make the clap, just stay nice and still for me. Ready? All right, don't move, don't squeeze, straight ahead. Perfect. Awesome. Just look right at the light. Things get a little fuzzy. Out, down, don't worry. Awesome. Still here. All right, that's great. That's the hardest step, all right?
What did I just watch?
That was creating the flap, so that's the first step in the process. You go over here to the second laser to correct the prescription.
Okay.
Okay. All right. Halfway there.
Justin.
Yes. Grady.
You can open your eyes.
Caitlin's gonna hate that.
That's the hardest part.
Yeah.
So what was happening as you went, like what I just watched there, almost looked
so-
like it frosted over.
Yeah, so basically, this is called a femtosecond laser, and it basically, like little gas bubbles can make a plane. It's about 100 microns, so super thin. It's a little flap that we lift up. That allows us to access the cornea, the front of the eye. And here, this laser will kind of smoothen it out and flatten it out for him, so that his prescription goes away, and then that flap goes nice and smooth right over, and that's it.
So visually, is he affected right now?
Right now it's going to be a little blurry,
Okay.
okay? But that was necessary so that we can get inside the cornea, and then here's
Okay.
where the laser can
Gotcha.
Yeah, it's a little,
Where's my best view gonna be? Just
it's a little
up
gray.
I
on
would
the
say
screen?
Probably on the screen at this
Okay.
point.
I feel like that's what it would feel like if you lost yourself.
Yeah. Look at it just a second now. A little cover over your left eye. Go ahead and open both eyes. Look down a little bit. Or maybe just keep your eyeball. Open both eyes. Just go straight ahead for me. And this is going to be that little bit straight forward. All right, so you're going down. Just go straight ahead. Get things in focus. You're going to be able to see a little blinky green line. See that there? Kind of as it should down. Good.
So,
Uh-huh.
what should I expect on this work?
So you're just going to look at the light. You're going to feel your eye moving around a little bit as I lift your flap. And then when the laser comes on, you're just going to hear some noise. And you might smell like a little hair dryer smell. That's your prescription going away. And then I have to put the flap back on. So you're just going to feel some gentle water rinsing your eye while that happens. All right? Again, you shouldn't feel any pain throughout this. Okay? Think you can handle that?
Yeah.
All right.
This is what you're rating. So D minus 1.75 here.
Okay. Alright, can you still see that green light there?
Ugh.
Yeah. Alright. Okay, so now we're gonna lift the flap. You might feel me moving your eye a little bit here. Perfect. A little pressure there. Put it back on that green light. See that there?
Sure we can hear him.
Straight ahead.
4 seconds.
Nice and steady here. You're gonna hear the laser now. Nice and still, right on the line.
25, 50, 75. Complete.
Okay, so now you're just gonna feel a little mix of water. Keep looking right where you are at the line. A little bit of water here, okay? All right, perfect. And then you look at, you can see that green light, that's the green, right there. Smooth things out for just about time. How'd that go? You feel anything?
No. I think the one thing I felt really was the water.
The water, yeah. Need a little bit more water here. Stay right here. All right, so now I'm just gonna put a few medication drops in all on the right eye. Go ahead and go nice and big there when you take out the medication. All right, perfect. You can just close your eyes here when you get it. Set up your left eye.
Brady treatment for OS. Minus 1.75, minus 1 at 80 degrees.
Great. Okay, go ahead and open. Drop down. Look down. And look all the way up. Please both eyes open. Straight up. All right. Let's go down here. Chin down just a second. Are you feeling anything specific? Let's play a little tougher, but just play a little bit. Sorry, a little uncomfortable, but necessary. Bring your chin down a little bit. You're just gonna feel me moving your eye a little bit now, okay? Yeah, bring up the light just a little bit. All right, we're gonna line up the laser again and keep it our ears really on this side. You're just gonna look straight ahead on the light here.
Give a pupil 9 seconds. 25, 50%, 75. Complete.
right now it's going to be kind of cloudy. It's almost like you're underwater. Okay, that's normal like this. All right, feeling okay?
Yeah.
All right, go ahead and sit up for me. Take it slow. Okay. All right.
You're hideous.
Now you can see it truly, right?
Yes.
All right.
I'm glad you didn't say I was gorgeous. Be a little worried about you.
We're gonna take one more look over here. Go ahead and hop up in the chair for me.
Shut this.
Yeah, thank you. All right. Go ahead and bring your chin right in there. We'll take one more look. Blink for me and open nice and big. Give me a nice blink. Big blink. And a nice blink here. And blink. All right, great. Go ahead and sit back. Everything went great, okay? So you're going to go home and you're going to take a nice long nap, okay? The more you keep your eyes closed today and rest, the faster everything starts to heal and the vision sharpen up, okay?
Okay.
Please, please, please don't rub or touch the eyes, okay? The flaps are still healing right now, so they're still kind of fragile, all right? We're going to give you some shields just to remind you not to touch, okay? So you can take them off when you use the drops and we'll go over those instructions, okay?
Okay.
But just take it easy. We'll see you back tomorrow. Everything went perfect. You're going to do awesome.
Awesome.
Okay? All right, any questions?
Can I ask what the brush was that you were?
Yeah, it's like a little sponge. So basically I use the water to make sure the flap is sitting right, and then the sponge just makes sure it's nice and flush,
Oh, okay.
right where it belongs.
Like
and
a
everything looks
squeegee.
great. Yeah, like a little
Yeah, like a
squeegee.
squeegee.
You'll see
Yeah.
it on the video.
Oh, did you get to see it?
Yeah,
Yeah.
oh
That's
yeah.
awesome. I can't wait to watch it.
All right. Okay, congratulations, Brady.
Thank you. Thank you for your help.
Okay.
You all set?
Yeah.
Oh, that's another profile picture right there.
That's cool. Do you have, if you don't have your own sunglasses, they're in here. But if you don't have any questions, you are all set.
My only other question is, am I able to be in there to hold her hand because she's going to be terrified?
There he is.
Talking her through it.
Great. You're going to do awesome.
Now, let me ask you a question. I don't know how you feel with your Valium.
Yeah.
I was gonna go in and hold her hand, but I'm sure she'd probably rather you hold her hand. But how do you feel?
I just asked Michelle if I could do that.
So do you wanna go in and hold her
Sure.
hand then? I figured
like
you'd
that?
probably rather him.
How stable are you?
Yeah, you got to be
You're falling on top of him.
I
Or
told her,
her.
yeah, you can't fall and yank her off the table.
It's not bad. There's only
How do your eyes feel?
just
They're numb.
yeah, blurry but they, like I said, it will get better.
Oh yeah, it's gonna be like you're underwater
Yeah,
right
it's like
now.
I'm underwater.
That's how, when you go to in a pool and get underwater,
Doesn't hurt at all.
so
It's
then,
just there's a couple of spots where there's some pressure, and I even told her
Yeah.
right after it was done, I go, that's the part she's gonna hate. But it lasted a second, and then
Keep
it's
taking
fine,
deep breaths.
and she's calming the whole time, and so is he, and it literally took. I felt like I laid down and it was done.
Yeah.
But if you like me, I will absolutely.
If it'll keep you at ease, I mean, for sure, come on in.
Yeah.
As long as someone holds my hand.
All right.
Yeah.
I want you to take a nice step up here. Just take a seat here. We're going to start with the drop. Come on out. I'm going to put a little numbing drop here.
You got this.
Sing a little bit, okay, but it does take some comfort.
It's way less than what the dilation valves were.
Close your eyes on this.
Good job.
Okay, well done.
Good job.
Nice deep breath.
Dump that bottle in.
Now you have a little bit of a stick in
Volume kicks in. It's actually really cool.
Pre- Pretty sure it's already kicked in. Just saying.
I feel like it's what it would feel like if you were blind. And that suction goes over your eyes and it comes up. It literally goes, and you lose all your vision.
You should see it happen.
100% right.
You should see it happen.
I was like-
I got it on film as it was closing in.
Oh, really?
On there.
Oh my gosh, it was so cool. I'm like,
I asked her about it on there, what that was.
You feel that?
The only thing I felt was the collapse at the end of the water because it was cold.
Alright, we're gonna have you lay down now, Caitlin. Your head comes right over here. You'll feel it settle in this little cup here.
Okay, if you want a blanket, we have a weighted blanket and a regular blanket. You also have this one over here, blanket, but it's a little, underneath here.
Okay. And lay your head all the way flat. Okay, just right there. Okay? Alright, here comes the blanket. And then you just remember to keep your hand either there or by your side. I don't want you to reach up and get underneath. Okay? Alright. You can just close your eyes and relax. Yeah, set up.
Am I okay to hold her hand on this side? Am I be out of your way, or?
Yeah, you can do it over here.
She just wanted somebody next to her.
Yep.
You're okay?
Just a little too covered here. Go ahead and open your eyes nice and big, Caleb. Put another drop in, okay? Close your eyes. Alright. I want you to hold tight as tight as you can. This is gonna keep your eye open. It's okay. Just gonna hold the eye. You're just gonna hold it. So real there. Perfect. Awesome. All this is doing is just keeping your eye open. Alright, and dry the eye off here. Gentle. Relax. Turn your head this way. Relax your head up, okay? And then you're sit there. Just nice and relaxed. You're letting go of your head. Just put a little bit. Both eyes open, easy. Nice and drop, okay? What I'm going to do is hold your head steady. I need you to focus right at that white light. See that light there? Okay, you're going to keep your head nice and low, okay? Come on. Bring that up. We're just getting lined up. You're doing great, okay? Take happy thoughts. You guys have any fun weekend plans?
We do, right? This is one. For
What you're
last,
known for, right?
yeah, last week.
Yeah, right. Well, that's last weekend.
Sorry,
girls.
sorry.
Yeah, it's tomorrow and Sunday, and then there's also the winter.
Oh, wow. Okay, good. All right. And you see that light there? As we get closer, you're gonna see a green light, and all you have to do is just stay very still on that light, okay? See the green light here? Okay. So really important, you just look right at the light, don't look anywhere else, just stay super still for me. Good, nice and still there. Excellent, don't move. Section off. All right, we're gonna make your clock. We need you to stay very, very still here. Just stay right there. Ready? Stay nice and still. Perfect. This goes by very quickly. Just stay right there. Excellent. Things are gonna go a little fuzzy here. Don't worry, that's normal. Just have like 3 more seconds and we're all done with this one. Doing so good. Perfect. Action on. All right, go ahead and look real big when you take out the line here. All right, that's great. You're well done with the right eye for the class, okay? Move the left eye now. That wasn't too bad, right?
That's the worst part.
Great. Like another drop here.
Watch up there on that. Her eyes are so cool looking up there. Like different than yours.
All right, take the eyes here. Keep your right eye open.
My butt keeps opening the door. Dang it. Trying not to move.
Nice and big. Right, get a little light. Good.
It's like frozen.
Okay, that's the hardest step. You did great, all right? Halfway there.
It is so good.
You're doing awesome.
Her eyes are like sunflowers.
Her eyes are so cool looking.
Yeah.
You're doing awesome.
Open your eyes, Caitlin. And then have you go ahead and sit up. Bring your legs to the right.
She had a portion on that last eye that looked like it almost was freezing out, like a just a spot. What was
it's
that?
just some extra bubbles from the laser.
Oh, is it? Okay.
Yeah. Do you feel your head in that cup? Yeah, that was okay.
Alright, go with your legs up there. 75, 50, 75. Sleep.
A little light on that one. Just a little water mixing the ice on. We're almost done. Try to stay still. This is that little sponge.
Yeah, I see that.
Yeah.
Yeah.
Just kind of make sure that flaps is nice and tight there.
And I felt like the worst part was the water. Everything else was fine.
Yeah.
The water, and I think it was just the temperature of the water.
Little hole.
Yeah.
Yeah.
Because you don't feel anything until the water hits. What'd she say?
So the water kind of where it's like,
Yeah, yeah.
everything to the top. Everything nice and tight.
This is a good.
Okay, just a few eyebrows and something. What about the nice thing there?
Halfway home.
Alright, one more eye to go.
Hey,
Hey-oh.
good job.
Caitlin treatment for OS minus 2.5, minus 0.75, 175 degrees.
What's that? So then I'm gonna
You good?
see that green light?
Brady, what are you doing? What are you doing right now? What are you doing right now?
Getting my hand broken.
Hmm?
Getting my hand broken.
Squeezing pretty hard. There we go.
Good pupil, 9 seconds. 25, 50, 75. Sleep.
It's all done. That's
It was
it.
great. Did everything you imagined? Yeah, you can sit up. All right.
You're good.
All right.
So good.
You're good.
Everything went perfect. Okay, we're gonna take one more look. You feeling okay to stand up? Okay.
With her hands.
Getting your crushed.
Step up. And one more look, okay? Come on, all the way down here. All right, give me a nice blink and look straight ahead here. Good, blink and open real big. Blink and open nice and big. All right, perfect. Great, you can go ahead and sit back. All right, so just like I told Brady, the important thing today is for you to sleep as much as you can, keeping those eyes nice and closed. That will help everything heal faster, okay? Please don't rub or touch the eye. It's going to be very tempting because it might feel a little irritating, which is normal as everything's healing. So make sure you use those teardrops as much as you need to, okay? All right, you will get those nice shields as well, okay, just to remind you not to touch your eyes, okay?
Is it normally from the side? I feel like something scratchy is kind
Yeah.
of in there. Okay.
Yeah, that's actually probably since I did your right eye first, that's probably the numbing starting to wear off.
Okay.
So that's where the scratching is. That's why keeping your eyes closed today will actually just be more comfortable overall.
Okay.
But then also putting the teardrops in when it feels a little uncomfortable like that. Okay? All right, any questions for me? All right, we'll go over the medications. And you guys are off. Not to Cedar Point though. That's at home.
Not today.
Thank you so much.
Thank you.
Of course.
You were
did
wonderful.
great. Yeah.
All right, like she said, your job is to go home and sleep now.
Complimentary pair of Maui Gems.
I have to re-listen to that, 'cause I was
Minimum
out of
eyes
it
closed for 3
the first
hours,
time.
but the longer the better.
Whatever Michelle wants.
Okay? The more you keep them closed, the better your eyes are going to feel, the faster they're going to heal. When you wake up, you're going to begin using your medicated drops. Okay, that's the blue cap here. You're not having to remember all of this. I'm just going to go over it with you, but it is all written down on paper as well. So every 3 hours today once you wake up, and then starting tomorrow, be 4 times a day for the rest of the week. And then 4 days, it'll be 2 times a day.
Okay, I'll let you know.
Okay, but like I said, it's all written down. These are the artificial teardrops that she was talking about. When you're wanting to rub, touch, scratch, because they're irritating, this is what you're going to use instead. We do not want you to touch your eyes, okay? Because if you create a wrinkle.
Don't touch them.
So we're going to put shields.
Shields.
This will remind you not to touch your eyes.
Yeah.
And I'm sorry if my hands are cold
Oh,
today,
yeah.
I'm freezing.
You don't have to wear yours anymore
Oh,
either.
but I liked it.
Unless you wanted to.
Hold on.
Did she do
Wear
okay?
these while
Yeah, she did great. She
sleeping.
was a trooper.
See?
There's extra tape in there.
Get some ice for Brady's hand.
So,
Oh, yeah.
did you have any other questions?
Crushed.
You get
None
to
that I can think of.
It's all done.
This is for you
You
to
just
keep.
you just got permission to sleep for as long as you want. That's the
Ayo.
dream for you.
Good to see you guys.
Thank you so much.
I don't know if Michelle mentioned, once the anesthesia wears off, like 2% of our patients get what we call the burn.
Yep,
If you get it, you'll know.
sure.
Keep your eyes closed, within 2 hours it'll be completely gone.
Okay.
Okay? And you may not get it, 98% don't.
Yep. And then we just start using the drops.
And then after about 3 hours of sleeping,
Okay.
when you wake up, you're gonna start using the drops.
Perfect.
She gave me a hug. She's so sweet. I just love her. You're gonna be great. It's all over.
It's all over.
Good job.
So we are one day post-op from our LASIK surgery, and We went in for our follow-up this morning and we're both testing 20/20 vision or even better, which is insane, especially for day one. Everything looks so crisp, so clear. It's freaking crazy. The eyes feel great too. A little bit scratchy, but just dryness, nothing that eye drops can't fix. So this is incredible. I'm so embarrassed to post the YouTube video because I was literally a crying mess the day of surgery. I'm so thankful for the staff because they were so comforting. They literally helped me the entire step of the way. They had so much patience, and I'm so thankful that I actually went through with this. And Brady, he was there holding my hand the whole time because I wouldn't have been able to go through with it without them. So it's so exciting. Here's to never having to wear glasses again. Ha ha! Woohoo!